Hello and welcome to another interesting episode of Health Watch. Yes, we all know that coronavirus is ravaging the whole world and the effect is seen in every aspect of the economy, from health to transport. The children are at home, schools are shut down, a lot of things are going on, and it's actually dictating the pace at which we do a lot of things. And one of the things that is happening right now is that you are confined to a particular place. Either that you're working from home or you don't go to work every day. This affects your body somehow because you are not as active as you used to be. And so today we have brought in a physiotherapist that will be telling us about the role of a physiotherapist in your physical activity promotion. That's our focus for today. Plus, we all know that wearing of nose masks is now the new normal. Everybody, before you leave your house, you must wear a nose mask. Before you go to the market, especially in crowded places, you must wear your nose mask. Now the question is, how effective is the wearing of nose mask in limiting the spread of COVID-19? We have a feature on that, and Dr. Makinde will be telling us all we need to know on nose mask. Well, this is another edition of Health Watch. My name is Nkem Okibi. We'll go on a short break. We'll be right back. Alright, you're welcome back. If you're just joining us, the program is Health Watch, reaching you on NTA Lagos Channel 10, the station for excellence. And our topic today is the role of the physiotherapist in the physical activity promotion. And to discuss that topic with us is Chizoba Emmanuel Onwamelu.
Thank you for
You're
having
welcome
me.
to
Thank you
Health
for having
Watch.
me, ma'am.
Thank you so much. Now, one of the first things we need to ask ourselves is, who is a physiotherapist?
Okay. A physiotherapist, the health professional or a trained health professional who is in charge or who is involved with the treatment of diseases, injuries, disorders, which can be congenital or acquired. Congenital in the sense that the person was born with it. Acquired, that it was developed over a period of time. So you can actually have some conditions that are chronic and acute. Acute is when the condition is less than 6 months. Recent cases. But chronic is over 6 months, and the case is still debilitating, as in continually progressing. So that a physiotherapist can actually manage such conditions.
Okay, let's talk about condition. What are the kind of injuries that a physiotherapist treats?
Okay, thank you for that question. Physiotherapists can actually manage conditions like musculoskeletal. That's where you have sprain of the muscles, strain. You can actually have back pain, neck pain, spondylolysis. That's arthritis of the back of the spine. So these are conditions, even the sprains of the ankle, like in sports medicine. Physiotherapists do a very effective and good job there. Like when someone develops a sprain on the ankle of the leg, so physiotherapists make sure that they have the treatment that is required or that the patient deserves at that moment.
Okay.
What do? They can actually place the affected area on rest. Then you can apply what they call cryotherapy. That's treatment with cold. Yes, you use the cold, you can get towel, put it in there, wrap it around the ankle. Even if you're not in sports, even at home, when you strip your leg, maybe you're walking where you have poor illumination, like on the staircase, like some patients, elderly people. So I always advise people, make sure there's light on the staircase. If your mom is elderly or your dad or someone around you, so that they don't strip their legs, don't fall. Because when they fall, they can actually have fracture of the bones.
Very interesting. So what do you think we should do as parents to ensure that, particularly knowing that the COVID-19 is ravaging the world, a lot of children are at home right now, online classes are going on here and there. So how do we manage our children? How do we monitor them to ensure they don't have such injuries that could ruin their life in the future?
Okay. Number one thing you should do as a parent is to make sure that your child does not have food low in calcium. Because if you have a child who has malnutrition, you now discover that the baby or the child can develop rickets. And that's where the bone becomes abnormal, the presentation becomes awkward. You can have a child that the legs become twisted, kind of, because of the abnormality presented in the diet.
And child was not born like that.
And child was not born like that.
Okay.
That's number one. Number two thing again, you now discover that if a child falls, make sure that you do proper examination. For example, before I came here, a child, some of my small friends on my streets, each time they see me, they always come to open gate. So when they came to open gate, and I discovered that one of them had a swollen hand, arm.
Wow.
So when I looked at it, and he told me that he went to bone setter. He fell down, so the parents now took him to the bone setter. And obviously they did the wrong thing. Because normally, if you're a therapist and you have such case, you're supposed to evaluate, diagnose. Could there be fracture? Could there be pigmentation? Could there be swollen, reddening? There are things that will show you that there's an injury to the muscle, to the ligaments, to the tissues surrounding that joint. So if you overlook such thing, and because that's what they do, because they're not trained health professionals. You know, physiotherapists, we spent so many years in university studying this course. So they did not go to school. And most of them practice in an awkward environment. For example, when a patient comes to me, what I do is to take the blood pressure. Is the person okay for this treatment? Has the person been feeling well? I check the color of the eye, the tongue, all those things matter. So if the patient is not anemic, you can progress to certain treatments. But because the person can actually feel dizzy at that moment and fall down. Even a child can do that if had not eaten. So the child can actually be anemic and fall down, and it becomes another case altogether. So these are things that you look out for. But bone setters, they don't do those things because they're not trying to do those things. So another thing again that you should actually watch out as a parent at home is that make sure that you don't leave your children unattended. Sometimes you see them playing with water, spilling water everywhere, and that could lead to fracture. Fall could actually lead to fracture. So make sure that your children are being supervised. Make sure that they don't run helter-skelter. Make sure that they don't wear things that could actually predispose them to falling. Like I know my niece likes wearing high heels, and sometimes you see her running with it. So these are things that could actually predispose them to fall, and then they can actually fall and have fracture. And when such child comes to you, you don't just start treating immediately, because that's what bone setters do. You check first of all rest the hand. If they are swollen, if the hand is swollen, or they call it edema, so you can actually apply some modalities. Like cryotherapy as treatment with cold, in brief. So then you can actually do some manipulations. You can do some strengthening exercises. You can do some coordination, movement coordination. So these are things that we do as physiotherapists, because when a patient comes to us, we have one purpose in mind, and that's to restore the patient to better quality of life. That's what we do.
Well, I'm just listening to you, and I'm wondering in my head that this is a lot of work for parents right now.
Yes,
and
right.
These children are just having their online classes, and a lot of them are even exhausted. They're tired.
Well, now that children are doing online lessons, another thing that could actually affect the children's musculoskeletal condition is poor posture. You know, they are sitting down, they have this kind of sedentary lifestyle on the computer, doing online lessons. So that's why you have to make sure that they have a right sitting positions. You have to make sure that they have the right environments. So they're not kind of having abnormal or putting pressure on the spine. Because this is what could actually lead to back pain. And back pain can actually affect any child. Can affect anybody, can affect any child. Like people that work in the offices. Even at home, some people work from home too. So they have to be careful too. Even we are working online, trying to do some things, some work, sitting on the computer 24/7. Make sure that you are doing the right thing. If you have pain, you can actually move around a little bit, do brisk walking, make sure there's blood flow. You can actually take warm baths. I advise people to do that. Because when you do that, the exercise is just to promote blood flow to the body. And this is what alleviates pain. Because we do some modalities that promote blood flow, like infrared. It's a treatment modality. So what it does to promote blood flow to the affected area, by decreasing pain.
Wow. Thank you so much, Chizoba. In fact, I'm sure that a lot of people that are watching us today, for the viewer at home that is watching, really now understands the role of of a physiotherapist, because what you just talked about, just touched the part where that is affecting the whole world right now.
Exactly.
Everyone is watching on the phone, they're watching their laptops, they're attending to work, school, and all of that. And I can tell you that is actually tiring.
Yes.
At times you have to lie down, at times you hope I'm sitting rightly.
Yeah, you are.
So let's go over to the next question. Now, you talked about bone setters.
Yes, please.
So what's the difference between a bone setter and a physiotherapist?
Yeah, as I earlier said, physiotherapist is a well-trained health professional. You know, we work in different places, in different environments like hospitals, health centers. We work in sports clubs. Then we work in so many places, even in your environments where you live. Somebody can actually have a need for physiotherapy because that's your field, because you want to improve the quality of life. You render the service, even without collecting anything in return. We do that because that's one of our ethics. Now, talking about another difference again is this. Just like I told you, sometimes we have to measure the range of movements of the affected joints, which bone setters don't. We use an equipment called goniometer, an instrument, to measure that kind of movement. So then when there are sometimes, if you don't attend to this particular joint, you can have joint stiffness. Bone setters, they go ahead and treat without measuring the range of motion. And then we have like pain charts, but the charts that we use to measure the level of pain in patients. From 0 to 10, 0 being no pain at all. So you can actually tell the patient, can you tell me what you're feeling? So if I assume that this chart is between 1 to 10 and 5, 2 to 3 being moderate, mild pain, then 4 to 5 being moderate, being moderate, 2 to 3 mild pain, then 3 to 4 or 3 to 6 being mild, then 8 to 10 being unbearable. So the person will be able to say, like maybe there's redness, there's inflammation. So it comes with pain.
Area.
Yes, it comes with so much pain. So when you touch that place, because you're kind of trying to evaluate the condition, we touch the patient can actually scream that the pain is unbearable. So you don't just start treating immediately.
So what is your body, what are they doing about it?
What they do, make sure that for every physiotherapy clinic or hospital that's outside has an up-to-date license.
Okay.
I have mine. So you can't practice if you don't have that. And it has to be displayed in your clinic to show that you're a professional and you're a well-trained professional.
So how do you regain the confidence of the patients out there? So you have a fracture, you're not looking for a bone setter. You're going to the hospital to say, I need to see a physiotherapist.
A physiotherapist.
So how do you regain the confidence if the society has moved away from the fact that people now believe that the bone setter is doing the right thing? He has done it for my friend, he's done it for my mom, and they worked. So why would I need to go to the hospital?
But sometimes, like, I have seen someone that went to bone setter. At the end of the day, the case became worse than it was. Yes, I saw someone that had a steel joint of the elbow. The hand is just like this. This presentation, that's how it presented. And as Gina said, she went to bone setter. So because at that joint, maybe there might be malunion of the fragments of the bone. There could be non-union of the bones. Because, the bones are joined together through ligaments, through tendons. Those bones are joined to each other. So if at the end of the day, you did not check out what is happening and what has caused the inflammation and what has caused the sprain, or sometimes people can have underlying causes. Somebody can have osteoporosis. And the person might not even know. Somebody have osteomalacia. And that's the lack of calcium and phosphates in the body. So if the person has something like that, so it could actually lead to breakage of the bone. Do you understand it? So what I'm trying to say in essence is this, that our body makes sure that for each person that's going to be in this practice has a good idea, a good training of what to display outside or what to give to the patient outside. so that you don't give the patient opposite of what you aim or what the aim is. Because the aim is to return the patient to a very healthy quality.
Okay, we'll go on a break right now. And when we return, you'll be telling us on the factors that could impede the development of bones. And why I said that is because you mentioned the fact that a mother should feed the child well.
Yes.
The child should not be low on calcium. We'll go on a short break now. Health Watch returns after this time out. Stay with us.
Coronaviruses are a type of virus. The one we're all talking about is new, and it causes a disease called COVID-19. Now, most people will only be mildly affected by it, but it can kill. It starts by infecting our upper respiratory tracts, which are the airways from your nose to just above your vocal cords. You may develop a fever as your immune system starts to fight the virus, and a dry cough. That's one where you don't produce any phlegm. The virus can then spread to the lungs, making it harder for people to breathe, and it can cause pneumonia. In the most serious cases, people can die from the coronavirus. This is because the immune system can go into overdrive, and that can lead to organ failure. So we need to do what we can to stop this virus from spreading. As it gets into your body by breathing it in or through your eyes and mouth, the best thing to do is wash your hands regularly and properly for at least 20 seconds. Catch your colds and sneezes in a tissue and avoid touching your face.
Thank you for joining us. The program is still Health Watch, reaching your NTA Lagos Channel 10, the station for excellence. We still have Chizoba Emmanuel Onwamebum in the house, and she's a physiotherapist. And we've talked about a lot of things. We talked about bone setting and physiotherapy. We talked about yes, that's bone setting and bone setters. There is one of the factors that could impede bone development and growth.
Yes, some of the factors that could actually impede the development of bone is, like we talked about, poor nutrition. So if you have a child who has not been feeding well on foods like food that has calcium, vitamin D, then it could actually affect the health and the growth of the bone of that child. But if a child is well fed, you have, I tell people, feed your children on fruits, vegetables, milk, because vitamin C is fortified with milk. Adults, I tell people, make sure that you do exercise. Very important in adults. Very, very important, because when you do exercise, osteoporosis is caused by a decrease or demineralization of the bone density.
Wow.
Yes. So when the bone has lost a lot of minerals, it becomes fragile or soft. And that could actually lead to fracture, and the bone breaking. Yes. So adults should make sure that they take enough calcium. Very important. Even the elderly.
All right. We've had an interesting time on Health Watch today. Very quickly. Okay. What are the benefits and what are the benefits of physical therapy? And very quickly, just in 2 minutes. And does it work?
Yes, it does.
Asking that question.
It does very, very well. It does. Whenever you have any condition that you want to see a physiotherapist for, make sure that you don't delay such condition. Benefits of physical therapy: exercises. It promotes health. It promotes good mental states. Because when you are healthy, they say the health is wealth.
Yes.
And information brings transformation. So when you are informed about physiotherapy exercises that can actually help you to have a good quality lifestyle or good quality life, you will become a better person. Physiotherapy, does it work? Yes, it does very well. Exercises, modalities, some interventions like manipulations. These are things that physiotherapist does, and it helps because the essence is to bring the patient or the affected person to a good quality life.
Wow. Thank you so much.
Thank you for having me.
You said a whole lot today. In fact, you can see I'm sitting up, trying to ensure that.
Thank you for having me. It's a pleasure being here.
It's right. So thank you so much for being on Health. Thank you for sharing this vital information at this time when the world is in pain. And I'm sure that we're going to heal. I'm sure that very soon the researchers, scientists, are going to put up something together and there will be the right medication for COVID-19. Thank you so much.
Thank you for having me.
So much.
It's a pleasure being here.
All right, moving on. We talked about nose masks at the beginning of the program. This is one of the precautionary measures that was set out to limiting the spread of COVID-19. And we have brought you a feature on nose masks. Enjoy it. We'll be right back. With the pandemic ravaging the world, there are preventive measures set by World Health Organization (WHO) to prevent the spread of the virus. This includes regularly wash hands with soap and water or use an alcohol-based sanitizer to rub hands. Maintain at least 2 meters between you and others. Avoid crowded places. Avoid touching your eyes, nose, and mouth. Practice good respiratory hygiene and wear a mask when going out. Wearing a mask is the new normal now. In fact, some countries have made it mandatory, with Nigeria inclusive. But how effective is it in limiting the spread of COVID-19?
Now, a face mask has been proven to be effective in preventing the spread of airborne diseases, including the COVID-19 virus. And if you wear a face mask, you are protecting yourself as well as protecting other people around you. For people who are already infected with COVID-19, wearing a face mask will prevent them from spreading it to other people. And for people who have not been infected, who are okay or normal at the moment, or who are not showing any symptom, it also prevents them from getting this thing from other people around them.
There are generally 3 types of mask: homemade cloth face mask, surgical mask, N95 mask. While they all offer some form of protection, caution must be applied when wearing them, and it should be worn properly.
Now, wearing a face mask is very easy. If you have this one that has the rubber, all you need to do is to put it over your nose and your mouth. Now, that's very, very important. You have to put the face mask over your nose, and then if you look at it properly, you see the part that has something inside, that's the part that has to be upper side. So people wear it the other way. That's not okay. This is the place that have to be on your nose. So you put it on your nose, and then you take it down and put the rubber, and then you can cover your mouth as well, and then you are good to go. Now take note that the face mask must be able to cover your nose and then your mouth. Now some people wear the face mask this way. This is the wrong way of wearing the face mask, okay? Now some people put it this way, and this is also wrong. Some people put it even under their jaw. Now anytime you do this, you are not wearing a face mask. You are just as someone that have not worn anything. So you put a face mask, your mouth is covered, your nose is covered, and then I can give a lecture. I can wear this for the whole day. Some people, it suffocates me. If you wear a good face mask, it doesn't suffocate.
COVID-19 is no respecter of person. Wearing a mask only is not enough to protect you from the virus. Follow all precautionary measures and live responsibly. Stay safe. You know how I love to do this with you every week. It's been a wonderful time with you today. We've talked about physiotherapy, the role of physiotherapists in physical activity promotion. We talked about how to use your nose mask correctly. You can reach us through our email or keepingchem@gmail.com or ntalagoschannel10@gmail.com, or send a text only to 07060865487. Remember, COVID-19 is real. Take responsibility and stay safe. See you next week.